As Heart Month comes to a close, this morning we're focusing on children's heart health. And with me now is Dr. Carlos Thomas. He's pediatrician and neonatologist at Pediatric Associates Bahamas. Good morning and welcome back to Bahamas at Sunrise.
Good morning. It's always good to be here.
Yeah, it's always great to have you on. I feel like we learned so much about children's health, but today we're talking about the heart. It's Heart Month, lots of love going around this month. Tell us, what are some of the common heart issues that you see in children?
Before I answer your question, I want to say something that's very important. And I want to put a plug in for early prenatal care. Your baby's heartbeat can be detected as early as 6 weeks into your pregnancy.
Wow.
And so your overall health and regular visits to your doctor is very important to map out how things are. So one of the things your doctor always does is listen to the baby's heart, right? When you go for your checkup. So heart disease in children either are congenital, meaning you're born with it, or acquired later on.
Okay.
So internationally, about 8 to 12 out of every 1,000 babies are born with some heart defect.
All right.
Most of them are not critical, meaning most of them do not require surgery or even medication, but some do. So as a matter of course, every baby who's born is fully evaluated to listen to their heart and making sure that the heartbeat is normal. So we see a variety of heart conditions, including what people commonly call a hole in the heart. And the hole in the heart means a normal opening that usually closes before birth remains open after birth. And that affects the way the blood flows within the heart.
Wow, I have so many questions just from the things that you've said. First of all, you said at 6 weeks we can hear the heartbeat. And normally when you would go in for a checkup, when a mom goes in for the checkup, the doctors are listening. What are you listening for at that stage?
The rate, how fast the heart's beating,
Okay.
and the rhythm. So a baby may have a very rapid heartbeat, which could be a sign of a problem,
Okay.
or conversely, a very slow heartbeat. So you're looking to listen to the rate and how consistent it is.
Okay. And at that stage in the womb, if you hear that the heartbeat is, the rate is too fast or too slow, what then happens? Is there anything that you do at that stage? What happens?
Great question. So there's some centers where they can do intrauterine things for irregular heartbeats. But for the most part, you will know your child has a potential heart condition. And so you'll choose where your baby is born. So if, for example, you have the option of being born in a different jurisdiction where they have more support facilities, you take that option. It also helps to decide where locally you're born, whichever two major health centers you're delivered at. One of them has a newborn intensive care unit. And so if you know ahead of time your baby's born with a heart defect, naturally the baby will go to the ICU for evaluation by a cardiologist.
Okay. And you mentioned that, that the child could be born with a hole in the heart and that it causes the blood to flow, I guess, in obscure ways. Tell us a little bit about that, because I'm thinking a hole in the heart, like I'm concerned, like how is this child living with a hole in the heart? How does that work?
So the heart has 4 chambers, separated by a septum. So there's a left side and the right side. And both sides have an upper and lower chamber. When the heart develops in the uterus, there's an opening between the upper chambers and a small one between the lower chambers. And typically they close at or soon after birth. Now, for some reason, some babies, it remains open, and therefore the flow of blood is affected, because the flow of blood has to happen in a very orderly manner through the chambers.
Right. And would you say that these issues are hereditary or it just happens?
That's a great question. Whenever we see a child with a heart defect, we always ask about family history. So it's not always a hereditary thing, but more than likely, if you have family members who have a history of heart disease, your risk is higher. And I just thought of something I want to say before I forget. We encourage women who are pregnant not to overly use NSAIDs, non-steroidal anti-inflammatory drugs. These can impact on the way the heart develops and how the blood vessels, the major vessels of the heart, develop, and can have significant impact on your baby's outcome.
Okay, so we talked a little bit about the heart issues that happen at birth. What about kids that just develop these things, later on down the line? What are some of the heart issues that you're seeing?
So acquired heart disease has to do, in large part, our lifestyle, diet, exercise, or weight. So you encourage our young children or older children or young adults to be healthy, to manage their weight, to eat healthy, to meaning balanced diet, push for fruit, vegetables, try to minimize your processed foods and red meat, for example. Those make a big difference. Manage your cholesterol, so every child and young adult should see their doctor regularly, at least once a year, where these things are checked and monitored. And the key thing is to have early intervention.
Okay.
And of course, as Grandma always says, prevention is better than cure.
Yeah. And what are those heart diseases? What do we call those?
Well, as you grow older, your blood vessels change. You can develop plaques in your blood vessels due, for example, to excess cholesterol. And that can affect the flow of blood in the vessels that supply oxygen to your heart. One thing I just remembered and I don't want to forget is, as if your child has chest pains that is getting worse, if your child has any fainting or dizziness during PE or during activity, that's a sure sign your child should be evaluated initially by the physician and then a referral made to a cardiologist.
Okay.
Recently, over the last several years, we've had a few young people who have collapsed in school.
Wow.
And so it's very important to have regular checkup where the doctor will always check your heart.
So if that happens in the classroom, I mean, we shouldn't take that lightly. It's not like, okay, go drink some water and get back up and go to class. We need to come and see the doctor.
Absolutely, absolutely.
Okay, all right. Well, listen, it's been a pleasure having you on. I feel like we always learn so much. I feel like we could have you on for another hour, right? Yeah, it's been a pleasure. Thank you so much for all the work that you're doing to keep us educated about children's health.
It's my pleasure.
All right. Ladies and gentlemen, you've been watching Bahamas at Sunrise. Be sure to get those children checked out. We'll be right back.